But today we've got Clay Hood, CEO of Precision Pro Golf, and Geoff Class. Is that how you say your name, Geoff?
Yep.
CEO of Sense Diagnostics. And what we wanted to do was, that the huddle is really all about being your supportive growth channel, right? You all have been on this before. I mean, the majority of people here have been, at least. And it's really to help you with sales prospecting, to help with thinking about your business model, and to help think about building your organization. To date, we haven't had any of our clients come and talk directly about some of the things that they're doing. I really wanted to connect that and bring that in and start to do that more frequently, because it's great to hear from subject matter experts, but it's also great to kind of hear from those with whom you can empathize and get direct thoughts and feedback. So the reason for bringing in Clay and Geoff is Clay comes from growing his company from more of a B2C angle, right? Precision Pro Golf, they sell range finders. I know that, Clay, you just mentioned that you're just launched a new product. And then Sense Diagnostics is a B2B company, right? And thought that this would be a great way for you to hear multiple different perspectives, all centered around the idea of focusing your business on, having the right strategy, having a focus on how you want to prospect and generate customers. And why not just hear directly from two successful clients? Not saying that the rest of you aren't successful. If you like this format and we want to bring you on and talk about your story, we'd love to have it. But wanted to kind of start to kick the can down the road of bringing on those with whom you can empathize most. So the way that we're going to do this today, and once I'm finished, we might as well do introductions, since we have a small enough group whereby you can then meet each other and then take those connections forward. But the format's going to be, I want to have 20 minutes for each of them to talk about their business. And then, so that's about 40 minutes. And then we can ask questions along the way, and even start to then ask other questions after they've both kind of covered the focus of their business, and take those questions directly from you, because we want it to be interactive, right? So that's the general format for today. Really reliant on, obviously, us thinking about questions we want to ask them as we go. And so why don't we go around the room real fast, and we'll end with Clay and Geoff for introductions, and I'll moderate who then provides introductions first. So Chris, why don't you start? And then I'll just go across the line here.
Sure. Thanks, Paul. Chris Bassetti, the CEO of OmniBoom. We are an integrations company, the technology company, really helping other businesses enable integrations between their platforms and third parties. We also have services around being able to have what we call AI enablement. So kind of bringing in AI into your solutions to help solve certain specific problems, application modernization, microservices, event streaming is a big thing for us, Internet of Things, being able to get device data and provide analytics around that as well. So glad to be here.
Cool. Thanks, Chris. Dan.
Yeah, Dan Jeeting. I'm sitting right next door to Geoff, actually. I'm on the Sense board and also the Ready Set board. And background was 30 years at Xavier University, 15 years at the Health Foundation, now Interact. And then left there, and a longtime member of Queen City Angels, and became, after I left Interact, a dues paying member. So hang on a sec, sorry. And so I do consulting with startups, and I'm also on some Cincy Tech investment committees and do a lot of volunteer work. And I'm also on the HCDC, HCBC boards. And we're in our new offices here on the 4th floor, and love to have you come and look at it. We want to be the showplace of HCBC.
Cool, thanks. Vali.
Hi, everyone. My name is Vali Tabian. I'm the founder and CEO of Always Education, a SaaS company that has a patented platform for community building. Initially, we targeted higher education, and during the pandemic, we decided to go ahead and create a version pivot toward small businesses. So we will be launching a new product under the brand name Broadcast Bubble shortly that focuses on customer engagement and employee engagement. And I'm happy to be among you and learning from you.
Great, thanks. And then apps.
Hey guys, Apple Garcia. I'm the founder, CEO of HealthGuard. We make risk management software for hospitals. We are a relatively new HCGC client. Nice to meet you.
Great. And then Olivier's in his car. He asked me to skip him. And so let's go to Anthony, which many of you know Anthony, but just to make sure, I don't want to.
Yeah, hey, good afternoon, everyone. Thanks for coming out today. Anthony Seppi, I'm the director of the Hamilton County Business Center, and look forward to hearing Geoff and Clay and their stories. And thanks a lot for coming out. Appreciate it.
Trish.
Hi, Trisha Safakis. I'm the marketing director for HCBC and excited to bring these programs to you.
Cool. And then Paul Fisher, Director of Innovation for companies that are in that $500,000+ range. We have a no-cost program that actually Clay Hood's company went through called the Office of Innovation. It's a strategic research program that helps identify qualified sales leads, grow sales up to about 20% for the companies that go through it. And then I'm also a business coach and partner with Anthony and Trish on running the huddle. So let's start with, how about we start with Clay? And what I'm going to do is I'm going to go and put the spotlight on Clay so that everyone can see Clay. Not that you can't right now, but Clay, we'll love to give kind of the next 15 minutes, 15, 20 minutes or so for you to talk about your business, and then for others to ask questions, and then we can shift to Geoff if that sounds okay. Is that fine with you, Geoff?
Oh, good.
Cool. All righty. So Clay, the floor is yours.
Okay, super. Can you hear me? Am I good?
Yep.
All right, sounds good. If I cough a few times, it's just my allergies. It's terrible time of year. So awesome. Well, my name is Clay Hood. I am the CEO of Precision Pro Golf. We are here in the business center. We're on the 1775 side of the street on the 3rd floor. And yeah, our story is, I enjoy it. I'll kind of talk a little bit about it. We are a golf technology company. We make our kind of main product line or golf range finders, although we are now moving into some new technology products, some software things as well. You know, we've actually just kind of gone through a kind of a branding and mission thing, strategy process. Our mission is basically to advance the way golfers use information on and off the course. Yeah, and a little bit kind of about just some of our numbers. In 2020, we passed $10 million, and we are now up to 22 employees. So we have come a long way, and we expect to continue at a strong growth rate this year. And I think in that, one of the couple things I'm really proud of through that one is that we didn't start the company here, but when I moved here, it was just myself and my business partner, and he lives in Philadelphia. So I started in the co-works place in 2015, and we have now kind of ramped that up to 22 of us, an entire floor. The other thing I'm really proud of is that we haven't taken on any investment. So we've done this all through sales and reinvesting our kind of profits into growth. And that is something that looking back, I don't know that we thought we could do that, but I'm excited that we did do that. So that's been a good thing. So just I guess a little bit about kind of the story of Precision Pro and how we came to be and where we how we got to where we are now. We didn't start at this place, so kind of my backstory is I used to be a golf pro. I worked at several different country clubs and Virginia and in Lexington. And then in 2012, I moved to California just for a lifestyle change. Didn't get a job right away, so out of necessity, thought I, start a company. I needed a job. So I met my business partner there, and we worked on a couple ideas that basically we were able to make a couple little training products that we sold enough of that we, saw money come in, but we knew that they weren't going to be enough to make a business out of. But it kind of got the itch going for, what we could do, what we could be. So in early 2014, late 2013, as we were kind of muddling along with these small products, we had this, we're searching for what our next kind of thing could be. The golf rangefinder market at the time was kind of very early on. There were only a couple companies and the products were very expensive, but we noticed they're very useful. They're very helpful to golfers, but not many people had them. So it was early in the market. So we had this idea, could we bring a golf rangefinder to market for under $200? At the time, most of them were at least $300 or above. So we set out to do that. And for those of you who don't know, a golf rangefinder is basically a device, a consumer electronics device you look through, and it measures distance on the golf course. Looks like, unprepared. This is not ours, but this is one that would look like. So you basically look through this thing and it shoots distance on the golf course. So that's what our main product line is. So basically for us to get started, we didn't have much money at the time or much expertise. So what we did was we worked with some suppliers in China and basically found a product we could source and put a logo on, come up with a name. And when we did that, we found a product we thought would be decent. We could sell it and it wouldn't, people could use it and it would work. We went out before we actually bought any of those, before we imported any of those. We went out and started cold calling golf courses and golf shops. And in the first month, we basically pre-sold about 300 of these products just on the fact that we had a price point that was $100 below anyone else. So after a month of cold calling, we're like, all right, we may be onto something. So we imported those products, we shipped them, sold them, and kind of went from there. And that kind of got the market started for us. Since then, we've been through a lot. For about 2 years, we just sold those source products. We saw some slight growth, not a lot. We learned some things. It was just the two of us. And then I think in 2017 or so, in that meantime, we invested some of our money back into making our own products. So now we create our own devices instead of just sourcing them. But back in 2017 is kind of when things started to really take off. So I guess for the first 2 years, we got to $1 million. First 2.5 years, we got to $1 million, but we were kind of stuck in that spot. In 2017, we actually came out with a couple new products, and we really started to understand online sales, online business, Amazon, direct to consumer, those type things. And that's where our business really took off. So in 17, we went from $1 million to $2.5 million in 1 year. And at the end of 2017, we hired our second employee. And since then, in the past 3.5 years, we've grown to over $10 million. And now we're transitioning ourselves to more of a golf technology company, less of just a product company. We just launched a new smart rangefinder that connects to an app. We're about to launch a smart speaker for golf that connects to an app, and we're about to roll out some kind of app features for the golfers as well. And it's been an interesting kind of ride over the past couple years. We've it's when you go from 3 people to 22 in about 3 years, that is a lot of transition, a lot of change, which has been good, but had its challenges. So that's kind of where we are. And our goals now, we have pretty defined goals. We think in the next 5 years we can get to $50 million in sales and have a 60-70 person team. So we are that's where kind of our mind is and where we go. So that's our story. I'll let anyone kind of chime in and ask some questions. I had a few things I can kind of go in some of our lessons, if you will. But Paul, I'll let anyone ask questions if they would like.
How about we ask a couple of questions, and then would love to turn it over to Geoff to give kind of a similar 10 to 15 minute overview, and then ask questions too of Geoff, and then we can just free for all and take down all the questions that we've got, because I've jotted down 5 in your preamble here that I could easily ask. Does that sound like a good model?
Works for me.
Cool. So apps, you went off mute. Yeah. I saw that.
Yeah. So a lot of good stuff. And first of all, congratulations on your success. That's an awesome story, and always great to see people people winning, as it were. So the question I have, Clay, is your decisions on where to take the company as far as products. What problems that you're going to solve, especially as you hit that $1 million mark and transitioning into the other products that you mentioned that you're bringing into market. How did you make those decisions? What kind of research did you do? What resources did you tap into, given the size of your team and the amount of capital you had at your disposal, et cetera, et cetera? Can you talk to that a little bit, please?
Sure. Yeah. In the beginning, we were researching into several different industries and just kind of, found this one by being in the industry and kind of understanding that these products. I would say one of the great things for us early on is one of the great things about not having much money is you have to be focused. So like you can't just you can't go get into a second product or a third product before you have had success with the first one, because you probably don't have the money to do so. And I think that I still preach it's so easy today to we're finally expanding outside of our core focus a little bit, but it's still very much in the same kind of mission. Golf technology helps people on the course, information, data. It is very easy to see something and be like, hey, we can do that, and get outside of it. So I would think until if I had to do something again, very focused, avoid the things that don't matter. Don't get into a second product line or a second customer focus unless you want to pivot, unless you think the one you're targeting is not good. Just keep, going there until you have the team, the resources. Everyone underestimates how hard it is to do something more. It seems like a product launch is easy. We rolled out a product yesterday, and it took a team of, 10 guys working on this months to coordinate all this. And it's just a huge undertaking. And you just don't think about what that is when you're hey, we can do that. So I would focus on the core thing until you know that's working or know that it's not going to work.
This is Dan. Current situation. I don't know where you get your product, but are you having supply chain issues?
Somewhat. We get our products from China, and we are with our rangefinders. We're not having a lot of supply chain issues. We have a speaker product we're coming out with, and we're having some chip issues. Basically, kind of at the end of the development process, we learned that one of our chips was discontinued because of the shortage, so we had to redo that, and that put us back a couple months. So it's bleeding into everything. There's actually an article in USA Today, actually not USA Today, Golf Week, about golf rangefinders and chip shortages, and we had one of our product director was quoted in there. So it's rearing its head, but it hasn't punched us hard yet.
Quick question that's kind of similar to what apps asks, and it might on the surface seem like it only applies when you're starting out, but it would definitely apply anytime you're launching a new product or extending a product line. But you said that you knew you couldn't make a business out of the first few things that you were doing. What were some of the signs, or some of the things that, as it relates to, or some of the actions that you took to help you help that make that crystal clear for you? Did you go and run financials and look at your sales process and your sales cycle to say, hey, you know what, it's taking us too long to get, to close a deal, or other things, other than that?
Sure. I think for us, when we started, we weren't business people. We didn't have experience in business or entrepreneurship really. So it was almost the financial side was an afterthought. And it wasn't until we actually started to sell some of these products where we didn't actually think about, hey, we have to sell 500,000 of these things to make enough money to actually have this matter. And do we think we could actually sell that? That'd be 100 times more than we're selling now. So it was basically an idea of we're putting these online. We're kind of developing an email list. We're developing some social media stuff. We're getting some response to it. We're just not selling that many. And then when you put the numbers on paper, what does this need to be to actually be a business where we could actually pay ourselves? And that just it didn't seem like we could ever get there with those, with the quantity we would need to sell that. So that's where we kind of came to that realization. also they were very, niche products. I feel like one of the blessings and curses of the entrepreneur is that they think everyone wants what they've got. And unfortunately, oftentimes they don't. So we thought everyone would want these things. And like, we actually found out that a few people did, and they really liked them, but they're just, if we talk to 100 people, a couple may be like, that's kind of cool. And then like one would buy it. So that's kind of where it took us probably 10 months to figure that out. So we probably could have figured that out in like a couple weeks if we were smarter, but that's kind of where it was.
Got it. So it was, you were out there hitting the pavement though, trying to sell, obviously, and like,
yeah,
looking at your conversion rate, and then you started to put pen to paper on terms of what the business model, like what would have to be true for the business model for it to actually like start to translate into, some real money, right?
Yeah. If you're out there like pitching your software to, your product you pitch to 15 customers and like no one is really responding to it, like you have to start to think about those conversations. Like, is it my pitch? Is it the product? Like what, and start to kind of get some feedback from maybe those people you talk to and like really think through like how that, what is, because it's hard to know when you need to change. And it's, I would think most of us probably would do it too late.
Got it. Want to shift it to Geoff. So let's take the questions that you have for Clay, and keep them in reserve here. We'll go back to Geoff, ask him a few questions, and then we can come back and start to ask more questions of both of them. Sound good?
Sounds good.
Cool.
All right, let me just give you this. I'm not going to take you through this whole presentation, but all right, first question. Did that screen just move?
No.
No, okay. I don't know if you all have the same problem I have with Zoom, but you have to share twice before it'll move. So there you go. Let me give you a little background on Sense. We have technology that detects, measures, and monitors neurological disorder of the brain, and it does so in real time, non-invasively. We've been around for a while, since 2014, and it's the product of the founders here, Dr. Shaw, Adeoye, and Flaherty. So they're in emergency medicine, neurocritical care, neurology. They deal with stroke and traumatic brain injury patients. Dr. Shaw, he came out of, Dr. Korfhagen came out of Dr. Shaw's lab at UC. But they had a problem that they had been dealing with, and that is how to really triage and monitor a patient that's had a stroke or had a traumatic brain injury for expanding brain bleeding activity. So, if somebody comes in the neuro ICU, they've had a stroke or they've had, they were in a car accident, they put them in the neuro ICU, and the bleed that is in the brain can expand quickly, and there is no way to really monitor these patients. So they end up, either with permanent disability or they end up dying. So it's a big problem that nobody has any technology to handle. So Dr. Shaw had previously worked as a physicist in the Naval Research Lab on radar. And his idea was, well, you know what if we took radar and turned it back inside and had it look inside the brain for different conditions? So that's kind of the way this whole thing got started. Again, as I said here, that there's no accurate way for EMTs, if they come up upon somebody, to tell if they're having a stroke, what kind of stroke it is, or if they're if they have a bleed from a brain injury. They can't tell that. And what happens is they deliver them, to the wrong hospital for the kind of treatment they need. And this, has tremendous delays in treatment. And somebody has a brain injury or a stroke, millions of brain cells are dying every minute. And as you know, from back in high school, when a brain cell dies, it does not regenerate itself. So, the real trick is to eliminate that time to treatment. So what we've come up with actually now we're in 3 devices that we're developing. The first one, and these are all the exact same technology is being used in each of these devices. It's form for function is what we've got going on. So the one on the top left, this hospital monitoring, this is for intracranial hemorrhages. So this goes on a person in the neuro ICU. If their bleed begins to expand, we alarm right away and they take the patient up for, treatment to stop the bleed. The one below that is used by EMTs. It folds up into about 12 cubic inches. So it could fit into an ambulance. But this thing is going to tell them if the patient's having a stroke, what kind of stroke it is, because there's 3 different types of stroke, and that determines the course of treatment. And then it's also going to detect bleeding from a traumatic brain injury. And then we are getting into a contract with the government. We're developing the one on the right. And this device will be used in the field. So a soldier, their Humvee gets blown up by a device or whatever. If somebody's suspected to have a brain injury, they slip this on their head, and it's going to tell them whether in fact, they are suffering from a traumatic brain injury. And then it will, if they aren't, it's green. If they are, it's red. If it's an expanding bleed, the red light flashes. And this will say, you really got to medevac this guy quickly. And the device will continue to monitor his brain activity so that when they get to the field hospital, the docs will know exactly what's been going on and what kind of condition that he's in. So 3 different devices, form as function. I won't get through the technology, but basically it's radar just looking inside the brain, and we're able to tell blood from normal brain tissue or ischemic tissue where there is no blood in a certain part of the brain from normal brain tissue. We've gotten this down so it works in 2.5 seconds to tell whatever kind of stroke they're having or bleeding. So that's it's like lightning. I mean, it's a snap of a finger. We could tell them exactly what's going on. Let me just kind of flip through to get through the studies here. Let me give you a bit of an idea of our competitive analysis, because this really drives where we go as a business. There are a few companies out there that are making something somewhat similar to us. They're all only making a device for use by EMTs, that's field assessment, but they all have limitations. You need to really be able to see all 3 stroke subtypes. You're able to handle a patient that's moving, because obviously some of these people are all going to be moving. You need to be able to monitor their condition continuously. So we're the only company that's able to do that. That is the one thing that sets us apart from the rest of the market, and what has really driven going from initially it was to be the in-hospital monitor device to the 3 devices that I just took you through. So let's get that page. We're in clinical trials right now, but let me talk about market and how we're going to be going to market. So initially we will start in the US, Canada, and India. And in the US, we'll start in the hospitals first. The value prop for the hospitals are they're going to have improved patient outcomes because they caught that person that would have expanded, and they did not have, degraded to the level of, permanent disability. But we also saved them days in the ICU, and that's going to save them up to $48,000 per day. All of how we design our stuff is gotten through market feedback. We do a lot of work with the hospitals to get that. We also have a scientific advisory board, which gives us feedback on all our product and market development. So the way we're selling the in-hospital device, it's going to be a razor blade model. So that monitor, which you saw, that'll sell for a bit under $5,000. They have in hospitals this CapEx process where if it's over $5,000, it's got to go through this ridiculous, process in order to get approved for purchase. So we're keeping that under $5,000. And then they wanted the headset to be disposable. So, and they said if you keep it around $500 to $750, works out just fine. So that's how we positioned it into the market. We'll start when we go to market with those centers that we're doing our studies at. And then we go into all the comprehensive stroke centers and trauma centers in the country. And after that, we go national. The big study that we're working on right now is exactly how do we do this national market, because we're building a company that, you know, we hope to exit 2 to 3 years after we go commercial. So going out and hiring this big sales force, you know, right at the same time you're looking to sell the company doesn't seem to make a lot of sense. So we're building up all our alternatives to doing that. From the hospital, we're going to be able to launch into the field, and that's first ambulance companies. But the reason we're doing it this way is that the chief medical officer for the ambulance company is usually the head of the stroke service or the ER at the hospital. So that's our key opinion leader that talks to the market that said, hey, you really got to buy this thing. So they have a value prop pretty much like the hospital. You know, they can accurately triage the patient, so that's going to improve the outcomes. And then it also gives them efficient use so they can bill at a higher rate because they have been able to determine they've got stroke or traumatic brain injury. We're pricing this one different only because that, you know, the ambulance companies really divide up into a number of different, into 4 different primarily. You have hospital systems which own their own ambulances. They'll buy these devices outright. And then you have independent operators that are paid for by city, county governments, and they're on a budget, those people. So they need to have something that they can, you know, they have a certain, you know, per month fee that they're gonna be charged. So we'll have a lease program for them. Then you have suburban fire and rescue, which tend to have all the money that they could possibly ever want to use. They'll buy it outright. But the rural fire and rescue is, you know, they're pretty poor, but they need it because if they got a stroke or they got a car accident and they got to call in a helicopter, that's an $18,000 ride. So they need to know if they're making that call that they're doing it right. So that's our primary market with ambulances, but where we're going to be going right after this, and we have an EMS advisory board we're putting together, but the next use of the device is at all these emergent care facilities that are popping up on every corner, nursing home and retirement facilities, but also it needs to be in every school and at every sporting event where you have, you know, you just have these terrible injuries happening. It was just a thing in the paper the other day of I think the kid was a sophomore or junior in high school playing second base. Someone's stealing the base. This kid takes a knee in the head and, you know, he ended up with a traumatic brain injury and he died that night. So had this device been there, it would have detected the bleed. If it could have been monitoring him, it would have detected the expansion and perhaps we would have saved a life. But you hear those kind of stories over and over again. India, the reason we're there, stroke's the second leading cause of death. 500,000 people die of a traumatic brain injury. We've gotten an investment from India, and we also are going to be able to do our clinical studies in there at a fraction of the cost that it would cost us to do it in the US. So we already have manufacturing and distribution set up in India. We'll go to Canada, not a big commercial opportunity, but they have great R&D capabilities for our future applications. So that's why we're going up there. And there's a big incentive to go up into Canada to do your business. Finally, the military is massive. As I said, we'll know in about next 2 or 4 weeks, we'll sign our contract with the US military to build that device for them. But what comes along with it is NATO. So we go and meet with NATO probably early fall and talk to them about it. They already know about us. They just want to meet up. So once it's approved by the US military, NATO buys it. And what's great about NATO, they buy enough equipment in one shot for an entire world war. So we're ready for NATO to come on as a customer. And then the other country, India, by the way, has the largest army in the world, and they're very interested in our military application as well. So that's pretty much, well, let me go through this because it's an important thing that we do as we, as we prime the pump for, for when we turn commercial, it's our, we keep developing our industry partners. So Emory University and Cleveland Clinic and Calgary up in Canada, those are very big academic, clinical research institutions that would be critical to have on your list of those that accept what you're doing. The other two important ones are down in the bottom. You have Vituity. They're the largest private practice physician group in the country, and they're in 20 states and growing. They pretty much have everything west of the Mississippi, and including Michigan, but they provide ER services to major hospital chains. So, and they're really into what we do, and they really want to help us with product development, research, and then getting it out into the market. MTech is our military connection back into the DoD. So skip Vituity, skip that. One thing I'd recommend, we've been doing, with COVID, you could, now with virtual meetings, you could go anywhere at any point in time and go to a meeting. So I've taken in the first few months of this year, every European conference that I could possibly do. And fortunately, we got picked up by an industry analytics group for investors, and we were named top 5 neurological device startup in the world. So that was good news for us. Now we're just investing, and we identify for everybody why invest. So we're still raising money, and around our existing market of stroke and traumatic brain injury, we've certainly been able to clarify what the unmet clinical need is. But the other big thing that we can talk to as our company is the multiple applications. So once we're done with stroke and traumatic brain injury, we know that we have an oncology application, sudden cardiac arrest, all neurodegenerative diseases. So what we'll do once we're close to commercial with stroke and traumatic brain injury, we're teeing up our research and development capabilities so that we have at least proof of concept for, say, stroke and sudden cardiac arrest and other neurodegenerative, because then when you get a buyer coming in, they're going to value the company on, the commercial product that we have out there right now, but also they would then, because of the effectiveness of that technology, they would give value to the pipeline of new products that we have going. So, as any, CEO knows that, you're here to create value for the investors. And so we'll do that by getting our current products to market as quick as we can, and then do R&D on the future applications. So that's it. Questions?
Cool. So questions for Geoff.
Geoff, this is Apps, kind of a tactical question.
Yep.
How did you go about identifying the stakeholders that that you were targeting for your go-to-market strategy?
Yeah. So first we started by putting together a scientific advisory board. So these are all neurologists and neurosurgeons from around the country that are well known within the field, and with them came the hospital systems that they work in. So that's a start. And then the other ones came in through where we're going to be doing our clinical studies. So Emory University, which is one of the most well known in the country, we went to Emory to have them be the lead site for our clinical trials. So that's how we got those guys in. Vituity called us, which was really interesting. So, but it's part of getting out there and making yourself known. I go to every med tech innovation session I could probably get to and just talk about it, talk about what we've got going on, get the industry awareness. And then really they've been coming to us lately. So, we're happy with that. But now we've gotten a real strong communication director for the company. And, you know, she's out there promoting us as far and wide as we possibly can be.
And you're currently still pre-revenue?
Yeah, we're pre-revenue, right. We'll probably launch commercial, I'd give it about 14 months from now.
And again, when did you start on this journey? When did the business form?
Yeah, they formed in 2014. I came here in 2019.
Okay. Congratulations, Geoff. Thank you.
Thanks.
A question on your claims, right? So you've got effectively, like, you're saying, hey, gonna save $48,000 per patient day.
Right.
Did you leverage, and that's perfect because it feeds up into the value prop, right, for the business. How are those claims evolving, right, with clinical trials? Then how are you also leveraging your partners to help substantiate and even build those claims further? Because it seems like that it's obviously an underpinning to like that value prop to want to, you know, bring it into a hospital.
Right, right. So we got the value prop through all our market research with the hospitals, and that's where we're able to validate the claim and what the value prop is for them. What was the other half of the conversation here? Forgot. So,
and then how are they evolving? Like, so for example, as you get more data, my assumption is that either becomes tighter, the range gets higher, right? Or,
right.
You know.
Right. So as we're in our clinical trial, we're going to be able to demonstrate the effectiveness of the technology to back up the claim that if we're, you know, for, let's say, the in-hospital monitoring device, each of the patients that we have in the trial are going to be those patients that we're either going to pick up the bleed, or we're going to be able to prove that after 24 hours, they haven't expanded, and they can then, the hospital could then have the confidence to move them out. So it's all the data that we get out of our trial just further emphasizes the quality of the technology that we bring. When we do our, and we've done first in human testing. So that's, you know, that's the first step to get there. But then when we get to the field device, you know, we'll be doing the same thing. We already have our basic research, which says, yes, we could differentiate stroke subtypes and bleeding. But when we run our clinical trials, that's when we validate, in fact, that this device is making the right call, you know, at like a 90 to 99% accuracy rate. So that's the data that, in fact, gets us selling into the market, but it is also the data that we're sharing on a regular basis, even today, with our potential exit partners. So we already have identified the exit partners too, which is important. And, you know, we've gauged their level of interest, and it's extremely interesting interest levels right now. So we just keep feeding them data. So we keep proving the point, you know, trial after trial and patient after patient, that in fact, what we say and what we, you know, have been doing is continually getting proven out through the testing and through the trials that we're doing.
Gotcha. And so it might be easy to say, hey, this is only applies to like healthcare, right? But like, what would be the things that you've learned? Because, you know, when I was at Procter and at Gallo, we would hammer home the importance of your claims, right? To like substantiate your value prop. What will be the things that are transferable that go beyond healthcare in your mind that are like things to make sure you're doing as you're substantiating those claims for those on the call?
To take it beyond healthcare? Well, we did hit, this is a pretty interesting one. We had a really cool meeting with a French company, and this company makes and designs the automotive interior of the future for a number of manufacturers. And, you know, they came to us and said, you know, what do you think? Can you, if you installed this technology in the cab of a truck, a tractor trailer, do you think that you could pick up, like, you know, somebody having a stroke or a heart attack or something like that?
Huh.
We're like, yeah, we could do that. But if you think about where they're going with it, so you've got driverless vehicles coming, to market now and all that, or you have, so what their whole thought is, so if we've got this, we detect the guy had a stroke, or he's having a heart attack, it could do one of two things. Automatically tell the truck, all right, you got to change lanes, you got to get over, you got to park, or take over control and drive yourself to the nearest hospital. And they could basically turn the tractor trailer into an ambulance and just drive the guy right to where he needs to be. So, that's just it's just one of the crazy things that happen, but it's all driven by, you got to communicate, you got to get out there and begin to preach to the market and let them understand what you've got going on and what the benefits are. And then a lot of this stuff, which is non-healthcare, starts flooding in because people say, well, wait a minute, what if you use it in this fashion and stuff like that? So.
Yeah. So what I hear you saying is like, hey, the more and more you get out there and talk about it and share it and like validate it.
Yes.
It even becomes more of an insight driver for other potential opportunities and to further drive value. Right.
Now, we're always going to be primarily healthcare, but, and what we've even had Columbia universities called up, and they measure intracranial pressure. The way they do that right now is they drill a hole in the skull and put a device in your head. That's how they measure your intracranial pressure, which is kind of gross, right? But we think with our technology, so we can measure the expansion of the brain, and the expansion of the brain will equal, the intracranial pressure that's getting developed. So, it could be a very non-invasive, who wants to have a hole drilled in their head, right? So if we could do it this way, it's going to make it a lot better. And then we also have some ideas in sleep and how we can help out with that as well. So it keeps going.
Cool. More questions for Geoff.
I have a quick question, Geoff.
Cool.
Sure.
Yeah.
Geoff, it's a pretty amazing device. My question is around really more like the use case of that. So you have the device which is capturing the information and like working with, let's say I'm in a ambulance or a hospital. How then do they get notified of the data that device is capturing? Is that also part of your platform? So do you have like an app or how do those people know? Or, I mean, I know with the Army, you said that there were some light indicators. Do they all have the light indicators?
Yeah. Well, it's all different. So in the hospital, where the first one I showed you, it had a monitor up there. So that monitor, every minute we scan the brain. So we'll know quickly if something's expanding and if a bleed is expanding. So we will be able to, we're going to put a real nondescript kind of message on the monitor. It'll alarm in an unalarming noise, but it'll say something like time for imaging, which to the nurses, that'll say, all right, we got something happening here. Let's get this person, we got to move them to get a CT done. This way.
Was that me?
No, I think it's Geoff's.
Okay.
I thought it was me for a second too.
Nobody was moving, and I'm like, oh, that must be me.
Well, here, let's, while we're waiting for Geoff to come back on, there's a question for Clay from Olivier. Olivier was asking if you could talk a bit more about kind of your online advertising and social media strategies and approaches that you've taken to grow your business.
Sure. Yeah, we can definitely get into that. So prior to say March of 2017, we didn't do a whole lot of online stuff because we were focused more on kind of the retail market to start. But then we started to kind of rapidly learn more about direct-to-consumer and Amazon. So we sell online. We sell our products on Amazon. We also sell them on our website. And there's a lot of things you can do to sell stuff online. So just at the very base level, when we started, email marketing, using emails that you already have, attracting new emails, having a website that looks good and works well, and then kind of advertising is a big part of that. So we did, in the beginning, a lot of Google advertising. If you're searching for a golf rangefinder, you'll see an ad of ours that'll pop up. Optimizing those. Google has a variety of different things through display advertising, YouTube advertising. And then we also do a lot of stuff through Facebook advertising. So if you're on Facebook or Instagram, you'll see kind of ads pop up there. So that was the beginning of online advertising. And then we also do Amazon advertising. Amazon has ads that are very similar to Google. If you're on Amazon and you search for socks, the first couple results you see will be sponsored. So how do you use those and how you optimize those? The progression of that is that we spent a lot of that, in 2017, we spent a lot of money on that. And then into 2018, we really ramped that up. In 18, we went from $2.5 million to $6.5 million. And most of that was through just pouring a lot of money into online advertising. And then now our strategy is similar, but we've added a new wrinkle to where, we're pursuing a lot of kind of partnerships with like podcast people and content creators to augment that. This online advertising can be expensive, especially as the market becomes more competitive. So now we're adding in kind of more brand things with that. We work with a lot of people who do content. They create podcasts or videos, and some are smaller, but some can be very big. And we use those as ways to kind of to add into the digital marketing channel. So when we have new things as we go forward, direct to consumer is a huge thing for us. It's a huge strategic priority. One thing we're kind of getting into for next year is like, you imagine like with Nike, you can build your own shoes with their own colors and your initials and things like that. And we're getting into that like personalization level with design your own product from us. And we're also getting into, we've rolled out a mobile app, and we're starting to, that connects to some of our products. And we're starting to, pull a lot of users into that. So soon you'll be able to buy our products through there. So we're kind of pushing kind of some of the boundaries of that direct to consumer as we go forward.
Hey, I want to go back to Geoff's response for Chris here in 1 second, but I have a follow-up question on Olivier's, which is in kind of designing or knowing who your ideal kind of customer profile was, right? Where they were, who they are, et cetera. Did you do a lot of like testing and learning early on, or did you go out and do a lot of like consumer interviews, et cetera? Like how did you develop that, and then how have you tested it, and how has it evolved, right, as you've grown?
We didn't do a lot of like consumer interviews in the beginning. We do that now more kind of from a innovation standpoint, to where we, if we have new ideas, we'll talk to customers, do interviews with them, maybe even show them a solution, show them a landing page and kind of get feedback on it. Or sometimes we'll do an open interview and just kind of ask them what kind of issues they're having, and try to use that to derive where we could go. I think in the beginning for us it was just a lot of like a lot of testing, or just a lot of trying stuff with different kind of online ads and things of that sort. And now, like one of the really good things about our industry, it's very specific. Like golf is a very specific thing, so it's not super hard to find people who are interested in golf. Inside golf, we have a little bit more of a niche to where we have a certain person we're trying to find. But because of golf, it is relatively easy to find. Or if you're selling, hand soap or something like that, everyone needs that. But how do you really target in on who you're trying to find that? So it's been, because of the ecosystem of golf, it's been a little bit easier.
Got it. So Geoff, let's go back to you in the response that you had for Chris. Right. Didn't know exactly where we got cut off, but
yeah. Let me just do this. I would say, Chris, with each of the devices, they all have it's all the same technology, but what we do is we manage the output for the use case. So in the hospital, we just keep it quiet and simple, so that the only ones who really know that something bad is happening are the medical personnel. And then the use case for the field, they need to know if it's a stroke, what kind of stroke it is. So we'll be able to tell them, you know, it's suspected this or suspected that. So it just allows them to triage that patient, because they could, if it's one thing, they could just get to the closest hospital. If it's another thing, you need to be at a trauma center or at a comprehensive stroke center. And then in the military, that was the ultimate, keep it simple, you know, so that we just know whether the guy, if he's fit to go back into battle. If he's not, you know, then we hold him out. But if his condition is degrading, let us know that too, so we could medevac him, you know, into a field hospital. So we really designed the output to meet the use case.
Yeah, okay, that's interesting. I don't know if you ever heard of Vyaire and HCA. We worked on a project with them as far as they were trying to detect acute respiratory distress,
Right.
And they identified certain markers, and based on like medications that were applied, could determine whether or not that medication was working. I didn't know if you guys had done anything similar to that, meaning like when you're in a triage, like, you know, how to know like what is working and what's not. And that's what I was also very curious about.
Yeah, so we don't go that far, because we will in future applications on clinical trials, but you know, right now we're all about making a decision for a patient that is in a high risk condition.
Yeah.
When we get into neurodegenerative, like you know, MS or Parkinson's and things like that, the application now monitors their condition. So if it's getting worse, they could have a take-home device, and it could, you know, transmit the data right into their neurologist. So the neurologist will know if the current medication they're on is helping or not, and they could change it up. But it's also good for use in phase 3 clinical trials. So let's say there's a new MS drug out in the market, and they got these patients on, you know, testing it. This will be able to tell them, you know, effectively whether, you know, this drug is having an effect or not. Or if someone has a brain tumor and they're in treatment, you know, they could take this home and it's going to be able to measure the size of the tumor. So if it's shrinking, they'll know. They don't have to run them in for MRIs and go through all that on a regular basis. So it speeds a lot of things up.
That's fascinating. Thank you.
Hi, Geoff, this is Vali. Have you heard of Therac 25, the radiation device that malfunctioned, and as a result of that, patient died, and the lawsuit that followed that? Are there such risks in your device as well?
No, not really. So if you were on our monitoring device for 48 hours, the amount of radiation that is passed through your, you know, your brain is equal to a 7-second cell phone call. So it's absolutely minimal. You're more at risk calling me on the phone right now than you will be on our device.
Apps, looks like you went off mute.
Yeah, thanks, Paul. Geoff, from a, I guess, industry disruption perspective, and this is probably more curiosity than anything, are you seeing that this is displacing or cannibalizing anything else out there? You know, you mentioned MRIs. Are you potentially, you know, disrupting some of that market?
No, and I'll tell you what, we don't even go near that one, because one of those competitors that we had on that sheet, they were actually trying to sell it to the hospital and say, you know what, with our device, you aren't going to have to use a CT anymore. And you have a hospital administrator now that just spent $1 million on a CT, and he's saying, okay, now I've got a boat anchor in my CT room because you just eliminated it. It wasn't a good way to get in. What we position ourselves as being very complementary to their current protocol. So it doesn't disrupt anything and make anything difficult with the administrator's decision. They see that it's complementary and it's going to save them money, in patient care and stuff like that. Now, do we eventually think it's going to replace CT? Yeah, but let's let the market determine that, and we aren't going to go out and say that. But we already know that there's some early, thought that, well, you know what? Because the way the course is right now, if somebody was getting monitored, and the nurse comes in every hour and they think, geez, he's not looking so good, the first step they do is take him to a CAT scan, and then they send them up to get a procedure. But if our device is there and we've just indicated that this bleed is expanded, they could skip the CAT scan and take them right up to, treatment.
So
we aren't pushing it.
are you also detecting like concussion and the like?
Yeah, we're going to be doing edema and things like that as well.
Okay.
And the military really wants that.
Yeah, go ahead. Sorry. Thank you.
No, go ahead.
No, I was just going to go off on a bit of a tangent. Personal story. My son was doing Muay Thai competition, Thai kickboxing, and after a fight where his last fight actually, he got beat up pretty good. He was 17, and we were on our way home, and he was trying to sleep from driving back from Indy, and we ended up calling 911, and they said you need to get to the Children's Trauma Center like now.
Right.
So we rushed there, and they couldn't diagnose the problem, and they went through MRI. A CT scan. They went through several tests to basically say it's a mild concussion. So the amount of time and effort and cost it took in that for that little incident was an all night. Yeah. So anyway, personal story.
Yeah. No, everybody has one.
Yeah.
Everybody has one.
So Clay, I've got a question that kind of ties back to this topic of conversation here as it relates to you. Have you found in your growth, right, as you're selling, that you've had to adjust your messaging to talk about things more complimentary, right? I'm not intending to be coy here, right? I could see caddies being like, oh my gosh, this is going to replace my job, right? Because now I've got somebody could go and like measure the distance themselves, right? Are there things that you've learned that have been similar in that like you took more of a adversarial type of process, but you've had to find more elegant ways to like sell the product as you've grown?
Yeah, I think it hasn't been so much from a replacement aspect such as that, but we have found that, there's always competition and kind of in a place like ours where, in the early days and even up until recently, there wasn't a lot of, we're selling something similar. So we're kind of building on brands. So we're constantly ahead and kind of changing our message. In the beginning, it was just price. And then we really focused on customer service and kind of, we focused on distribution channels being ahead of the game on that. And then we added an idea where we started giving out free batteries, replacing them for free to people. And then we were like the first people to get into like these kind of golf influencers and podcasts. So, and now we're moving more to an innovation kind of space and, some products that are more IP protected. So we found in the 7 years that like we have just had to constantly kind of evolve and be ahead of what's going on because there's just people behind you that are going to try to do the same thing you do. Hopefully now we're kind of, if this goes to plan, like we won't be chasing that as much, so we can kind of, build a defense around some of this, innovation work we've been doing over the past few years.
Yeah, so it sounds like you've been very focused as it relates to like a simple message. And then as you've grown and established core customers, then you've been able to say, hey, let's follow those core customers and provide value that's, again, in a simple message of things that are going to be immediate value for them and you haven't tried to like sell everything to everybody. You've tried to be very focused. And as you hit on a new aspects that provides value to that core customer as they've grown with you. Is that accurate?
Yeah, it has been. We've kind of just built kind of, step by step, and that's enabled us to like, the market for our products has kind of prices have gone down, as you see, like a lot of times with anything you could, any consumer good, anything you could buy on Amazon, like it's gonna like, go down over time, and there will be a few brands that stay above. And we've been able to do that. So we've been able to actually raise our price as the average price has gone down because we've, been able to kind of identify on those key things. And now we have a lot of customers who really like us. And the bet is that over the next several years, they'll just continue to buy from us because like they've had an awesome experience with us for several years. And but it's been through just, kind of capitalizing on those things kind of at one after the other.
Clay, this is Vali. As you are growing, what type of pain are you experiencing to scale in both operational side as well as customer engagement side?
That's a great question. It was one of my notes to make. It's been an interesting couple of years for us. Operationally has been a challenge to where we've grown a lot, and it's been hard for us to keep operationally. Like we've had inventory issues over the past couple of years. Like they just continue to kind of come up, and so that's a place we're putting a lot of effort. And like we didn't like build the kind of operational base we probably needed, whether it be just supply chain, financial, all those things. We were really focused on marketing, sales, pushing products, and having a good kind of brand image. We didn't build that underlying like operational base, and now we're having to kind of catch up a little bit. So we brought on some key people to help with that, like supply chain director and a controller. So that has been a thing. Customer wise, I don't, there hasn't been a lot. I think the biggest thing as far as the growth goes, as far as pain goes, is just the transition with the team. When you go from 3.5 years ago when there's 3 of you, and myself and my co-founder, and then our kind of operations guy, we're essentially doing everything. Shipping products, answering phone calls, like doing just a little bit of everything. And now, we've split ourselves into more defined roles. There's 22 of us. We have teams. We have staff meetings. We have like just all the stuff that you don't have when you're 3 people. Like you're a real company. And so like for me personally, I've gone from just like being a guy who does everything to now like the CEO, and that we just went through a strategic planning process. We're trying to really wrap our heads around like how we want to manage the company and how we want to, our org chart 3 years out, and like how we want to, what we want things to look like and how we want to build the culture. So there's just a lot of changes that come quickly, and it's not always easy, and that's not always fun because if you can't make those adjustments, you're not gonna grow. And that's been a challenge for us that we're actively working on.
Thank you.
Trish, I know you had a question.
Yeah, I was just, some of the questions that we get are, what platform did you use to hire your employees? Did you use LinkedIn? Did you use Indeed? Did you use word of mouth? Like, how did you grow your team? What platform did you use?
That's for both Clay and Geoff, right?
Yes.
I'll go ahead and so we use all of those. So like if we have a couple jobs, we probably have 3 jobs posted now. We'll use LinkedIn, we'll use Indeed, and we'll also use ZipRecruiter. And then I have found that it depends on the role as to which platform kind of produces a better outcome. If we're looking for someone very specialized in something that's very skillful, like usually Indeed is a better place, or someone with more experience, or for someone maybe at a younger age or a less skilled role, then the other platforms, the Indeed and the ZipRecruiter, can be good. The issue I found there is that you'll get 300 applications, and it's like almost just soul crushing to have to go through and like sort those. So it can be it can be tough just because you're getting so much. But I found LinkedIn to be a better source of like skilled people, along with just kind of like networking and recommendations from colleagues and advisors.
Yeah. For us, it's been the same thing. It's been colleagues and advisors have brought us, most of the talent. We're also supported by, we do a lot of contract work. And as we get to a point where we could support that person, on our payroll, then we just convert them in as a full-time employee. But we haven't been in that kind of growth mode yet. how we end up handling the sales force, that'll be a real specific hiring process that we're going to have to develop, but not too sure yet how we're going to do that.
Other questions? Chris?
I had a quick thing about Clay. Clay, I actually own 2 of your range finders. I bought one for my son years ago at the golf ranch on 42 here. And then I really liked it for him. But he always had it. And so I got one for me as well. So they're really good.
Awesome. That's great. Oh, go ahead, sir.
Oh, I was just curious to know, you mentioned B2B and B2C. I was curious to know, like, all the different channels that you market through, that you sell through. I know you said Amazon, your own website. Do you do like marketplaces as well? And then also do you ship internationally?
Yeah, so to answer all those, we do Amazon Marketplace. So if you're not familiar with Amazon, most people are familiar with, they bought stuff. Amazon operates in a couple ways. One way is they'll buy products from you at a wholesale level, and they usually do this with bigger customers. The other way that we do, and most of the stuff you buy on Amazon comes this way, is we actually ship it to their warehouse. They hold it, we own it, they sell it, and then they take a percentage of it, a small percentage of it, and then they pay us. So there's a couple different ways. The average person buying there wouldn't really know. Amazon is a big portion of our business, probably 40%. We're trying to work that down, not by cutting them off, but by raising some other channels. We do sell direct to consumer, which is a good portion of our business as well. And then at the retail level, we work with anywhere from a Dick's Sporting Goods, who are in 300 or 400 of their stores, all the way down to the smallest golf course that you may find. Obviously, a Dick's Sporting Goods is going to make up probably 25% of our retail business, whereas a small golf course may only sell 3 or 4 products a year. But it's it's a decent thing to have them there as a kind of a marketing thing. So we're very diversified across our distribution, which is good. Because we can't be hurt too badly. If we lost to Dick's Sporting Goods, we'd lose maybe 7% of our business. That's not good, but it doesn't debilitate us. As far as internationally goes, in the past we did more international. We've actually made a strategic choice to pull back from that because it was hard for us to, we just couldn't operate the same way we wanted to in the US. We couldn't be the same company. We couldn't provide the customer service. We couldn't do the marketing. So we were selling to some international distributors and we just kind of piecemeal here and there. So we pulled back from that a lot in the past year, and we're focusing on, Canada and the UK as our kind of key places to try to expand to. It's really hard just because it's not a huge priority, and it just doesn't come up at the top of the list. So we are trying to push more international business, but it's not been particularly easy for us yet.
Does Amazon, do they try to, or any of the Dick's, try to dictate the pricing, or do you basically have the negotiate it's a fixed price across all your channels?
So with Amazon, since we actually own the product, we dictate the price. So for pretty much all the third-party sellers, Amazon will take 15%. It's not really can't really negotiate on that. That's just a thing. If you're selling to them wholesale, there'll be some negotiation. Dick's is a little bit different. The thing we found with a big store like that is they don't actually, let's say that we sell a product for our wholesale price is $150. They don't come to us and say we want a discount. What they do though is they'll add in a bunch of terms and stuff behind that. There's a 5% co-op, and you're going to have these fees every time you open a new store. You got to pay us $1,000, and if you ship this box to us wrong, we're going to charge you $50. So they get a better margin because they're working a lot of stuff on the backside. But we actually haven't seen them come and say we want a reduction. It's usually just these crappy fees.
Yeah, they definitely rob you on the shipping instructions.
They make it so hard. It takes they get a new routing guide. It takes one of our guys 2 days to read it, and then they make it as hard as possible.
They do. Thank you. Appreciate it.
Welcome.
Question for you, Geoff. So off of what you shared, it sounds like that there's a lot of think about building blocks in your first year of sales, right, to like potential paths of growth that could have some pretty big, sizable building blocks, right, that you would potentially sell, right?
Right.
To what extent over the next 14, 16 months is all about capacity management and being able to fulfill orders when they come in?
Right. So what we've done, we're in the process right now of hiring somebody to head up manufacturing and quality. And we're going to manufacture in the US for the US and the out, at first. And we have our projected sales that we're going to, try to hit. And then, for global, that's why we've gotten to India already. And we have the manufacturers set up there. So they'll have the capacity to expand and support, sales throughout Asia, Africa,
Yep, got it.
and Europe. So
Cool.
and we'll probably end up doing all of our manufacturing, offshore at some point in time.
Yep. Great. Are there any, so we've got about 10 minutes left. I mean, don't want to belabor it. This has been great. Are there other questions that people have that they want to bounce off of Geoff and Clay?
I have one question for Clay. As you target your customer within that very focused target market, what have you discovered about the highest benefit to that segment of the customer from your product? Is it, for example, very valuable and beneficial for beginner golfers versus non-beginners?
No, so that's a good question. We do target. We have an inside golf, but probably a more specific kind of group that we target. And I would say that it's golfers. It's not even golfers who they don't have to be good, but they have to be serious. They have to be more serious. So it's people who are serious about playing better and playing well. So we usually say it's in golf, most of the highest demographic are men. And it's usually guys from who are 18 handicap or below and play at least once or twice a month during the season. So for beginners, I think it can be useful. It's not necessary, but most of our people are again good is not the word. They're just more serious about their golf games. And then inside that, we're launching into niches that are even more for golfers who are serious about their game. Like a couple of our product we just rolled out has a very high degree of personalization for the golfer based on their ball flight and their kind of swing. So that is even driven more to the golfer who is serious about their game. So it's just trying to find those little niches within the niches, and then hopefully that can become a big enough thing to kind of spread outside that.
Thank you.
Cool. Awesome. Well, just want to take a couple minutes first to just thank both of you for joining us. This is the first time we've had instead of having subject matter experts come in. I mean, you guys are both subject matter experts in your businesses and in many spaces, right? But more specifically focused on what your client stories are and how you're growing your businesses. I thought that it was really insightful on many different fronts beyond just the business model angle, but also the how you're thinking about customer development, what the evolution of the business looks like. So just want to thank you both for taking some time out of your day and sharing this with us. I think it was valuable. We recorded it because there's obviously typically we at least have 5, 6, 7 people that join these that are recurring people that come to the huddle, and they'll ask for it later to take a look at it and get your insight on our recordings. And so to that end, one thing that I wanted to make sure was clear or on people's horizons is for the upcoming sessions, we are going to start to transition how we send out the invites. And so we created something called a Mighty Network, which is an HCDC Mighty Network, where we're going to host the meetings from there. And then it'll also be a place that we can house all the recordings for each one of these sessions, so that you don't have to come and ask us for the specific recording anytime you want to watch it in the future. And so this is just the current kind of like going or a way in which we're going to house the actual content for now, as we determine whether or not this is the long-term solution versus other solutions that might exist, ongoing. But to make it more seamless, and so that you can go and say, hey, I want to go back and rewatch Geoff and Clay because there were some specific points that they made. Well, instead of coming to Trish, Anthony, or myself, you can just go right into the Mighty Network, search for the actual event, and then rewatch the recording in there. So that's the current solution. There might be one that we would move towards in the future, but it's just easier, on everybody. In a month, we've got a guy named Sadale Turbowski. He's the CEO of opengrants.io. One of the topics that we want to bring to people is, hey, we talk about investment dollars. Well, he's an expert on grants, and why not tap into, quote unquote, free money before you potentially look for equity investment. And so that'll be the focus that we'll have in June. And then in July, we have Nicole from Queen City Certified. She's a client of HCDC, and she's going to focus on how to build a strong, equitable culture within your company. She's an expert on the space. She does certifications for companies here locally on equitable workplaces. And she's going to talk about some strategies that you can employ to help build your organization. So look out for those invites, and thanks again for joining.
Very good. Thanks, Paul.
Thank you, guys.
Thank you.
Yes,
Appreciate
thank
you.
you, everyone.
Thanks.
I appreciate it.
Great
Thanks.
session.
Bye now.
Bye.